Hi everyone, my name is Aroop and I'm one of Menlo Park's vloggers. I'll be keeping you up to date with my thoughts and experiences over the next couple of months. I have some questions that I'm going to answer right now, but be sure to follow Menlo Park Recruitment on LinkedIn, Facebook, Twitter and YouTube so you don't miss any of my videos. If you do have any questions for me, pop them in the comments below and we'll make sure to answer this in the next vlog. Today I'll be sharing some information around the GP training program and a few experiences that I've had. The first question, which is quite an obvious one, is why did I choose GP? And I think there's a lot of things that can be said about this question, but I'll pick three of the particulars for me. The first thing is the training program length. I think 3 years trumps plenty of the other specialities that people apply for, which can be 7 to 8 years in total. This is something that means that you finished relatively rapidly in comparison to your colleagues. So you can get straight into the thick of it and into working fully as a fully trained GP. The next thing to really say is the lifestyle. And I think, the work-life balance is an important thing, thinking about the future and the current sort of global setting we're in. I think burnout is very much a part of being a clinician to some degree in any training program. But I think in GP, this is something that can be managed a bit better. Once you're qualified as a GP, you can pick to work in your own particular ways, whether that be locum or as a salaried or as a partner. The final thing to say about GP is it makes you a generalist of a clinician. You're not just focused on one speciality. I've always appreciated being a generalist. It makes me quite fulfilled as a clinician, and to know bits about a lot of different things. That's something that's always pleased me to some extent. So I've been on my GP practice rotation in North London since August. The things I have enjoyed so far include the continuity of care. So patients that you see, you tend to see them multiple times over a month for a variety of illnesses, but you really get to know your patient. And I enjoy the rapport you can build. This is something that definitely contrasts hospital medicine, where once you've treated your patient, you're not really in touch with them anymore. Okay. The other thing to say, particularly about my practice, is I'm in inner city North London. There is a mixture of languages and cultures present. I think this gives quite an interesting spin on GP, and possibly an extra, you could say, difficulty, but it is an interesting dynamic because there's a lot of different pathologies that presents with people of different nationalities. It's something that I'll speak to someone in Portuguese one day, Polish in another, Hebrew in another, and I think it gives you get quite a good understanding of different cultures inadvertently in doing your consultations, which I found quite interesting, to say the least. My advice to GP trainees in the current climate is quite simple. In terms of the application process, good preparation for the MSRA exam. This is one of the exams that multiple specialities have to sit, but it seems to be the core of the application process in GP. Just revise well, give yourself enough time to cover the content. It contains a lot of core medicine and specialty medicine. Essentially, it's like a general MCQ exam. If you prepare well, generally you will do well. Okay. There are obviously several question banks that exist out there. I've used things like Past Test and Past Medicine. These are usually very standard resources. But I think in the current climate, the only part of the application that GP trainees really need is the MSRA. I know in others there could be interviews as well, but I'm not sure how that will change for the future.